Hello, I'm Gordon. I'm a sports massage therapist here at Bankery Spinal Health, and today I'm going to go through knee pain and what to do when you're presenting with knee pain. So first of all, what causes knee pain? So one of the kind of main things that can contribute to that is posture and gait. So how you carry yourself on a daily basis, essentially. So little things like if your hips are slightly out of alignment, so if your pelvis is sitting down to one side, then more force is going to go through that leg and through the knee joint. So straight away, more forces are going through that knee, which can present in pain. So simple things like that, how you stand, and that will affect your walking as well. Carrying excess weight. So if you're overweight, there's more of a chance that you're going to get knee pain because again, there's just more force going through that knee. So this is also something to take into consideration from a health point of view. A lack of muscle strength and flexibility, which is something that's quite often neglected. So if your muscles aren't as strong as they should be, so your quadricep muscles in the front of your leg and your hamstring muscles in the back of your leg cross over the knee. Quadriceps muscles, they help to extend the knee, extend the leg, and hamstring muscles, their main function is to flex the knee and flex the leg. So if they're not working properly, then your knee essentially is again more strained, and if they're not as flexible, then your legs more rigid and you'll struggle a bit more, and then again you'll be more susceptible to knee pain. Work, if you're sitting down for 8-10 hours a day, your hamstrings, what will happen is they'll get shorter and they'll get less flexible, and then again it'll put more strain through the knee here because it crosses over the knee down into the calf. Things away from work, so if you, for example, depending on what you do, if you play football, maybe on hard surfaces with football boots, if you're changing direction, this then puts immense stress through the knee, so it's really important to kind of warm up and strengthen the muscles around those joints, get flexible. If you like to run a lot on pavements, this can create a huge force through the knee, so again it's just something to be aware of. Another thing, if you've had any previous injuries, certainly around the knee, but even if it's ankle, hip, you're certainly more susceptible to knee pain. So that's just something else to be aware of if you're presenting with any symptoms, and essentially just to go back through your own history. So how can we help prevent knee pain throughout life? Some general tips. So as I mentioned before, carrying any excess weight can put major strain through the knees. So the more weight you're carrying, the more ground reaction force that's going through the leg, and the knee plays a major part in supporting the body. So this is definitely something to be mindful of. If you're unsure, you can check the height to weight ratio charts that are online, or you can consult with a GP as well to find out what your kind of ideal weight is for your height, for your body type as well. Another kind of simple thing is, if you're walking, running, exercising, anything, and it feels sore through your knee, particularly through often it can be one knee at a time, kind of stop, reduce the activity, start to learn your body. Don't put yourself through any kind of excess pain if you don't need to. From there, listening to your body is important. This goes with being in the gym as well. If you're doing something that's continuously sore through your knee, it's important to stop and kind of try and figure out what the issue is. So in terms of acute knee pain, so knee pain right now, in terms of being proactive, the first thing I'd recommend doing is use the RICE protocol. So around the sore area, the inflamed area, so first of all, the R is rest. So certainly rest for the rest of the day, for the next couple of days, 48 hours if it's very acute. Rest, ice. Use ice around the affected area for no more than 15 minutes. Do this between every kind of 3 hours through the day until the symptoms and the inflammation kind of cools off. Compression as well. So as you're icing, try and compress the knee and elevate. So have your leg, for example, up on a stool with ice around the knee, and this will reduce inflammation, reduce blood flow to that area, and it'll reduce any pain, and it works as an analgesic there as well. Another thing to do is, if the symptoms stay for longer than 48 hours, see a chiropractor or osteopath for a screening. So what they can do is they can do a postural analysis. They can see if there might be any areas where you might think, you know, you're more susceptible to knee pain on this side because your pelvis might be sitting a certain way, your shoulders might be sitting a certain way. Look at the whole kinetic chain from there. So that's something always to think of. Massage as well. So around the affected area, say that might be inflamed, and the muscles then around that area, you will naturally protect whatever side's sore. The muscles then get tighter, get sore, and we can then come in and help from there and work through the deep tissues and loosen the muscles off from there. Light exercise, non-load, non-weight bearing stuff. So in terms of using a static bike, swimming as well, very, very light walking. The beauty of using a static bike and swimming is there's no load going through the feet, there's no load going through the knees. So you're keeping exercising, you're getting blood to those areas, which will feed nutrients to the affected area. So that's something that's always good to do, but keeping it very light at the acute stage. Stretching the main muscles around your knees, so your quadriceps is say in the front half of your leg, the top of your leg, your hamstring muscles, the back of your leg, and your calves as well. So it's very important to keep these areas supple, flexible, as it will reduce the strain, reduce the load through the knees, and also proprioceptive work. So proprioception is the proprioceptive muscles around your knees, which essentially can help in balance. So if you're to do the likes of a single leg jump, when you're landing, your proprioceptive muscles are firing and allowing you to stay stable. So the better they're going to be working, the stronger your knee is, and the less susceptible you'll be to going over on your knee, hyperextending your knee. So it's important to keep these kind of activities going. And finally, things like yoga, Pilates as well. These are great for generally maintaining flexibility and strength as well, because it's a whole kinetic chain. This will help strengthen your kind of whole body. And those are the kind of main areas to focus on. We're also here as well, so should you require any more information, any further guidance, contact the clinic and we'll be more than happy to help. And thanks for watching.